Public opinion data over the last 10 years consistently shows that the majority of Americans are unaware that racial ethnic inequities exist. We are never mobilized to solve a problem if we don't know it exists. And then to the extent that we are aware that it exists, then we really, truly don't care. That's the challenge of telling the story in a way that people can understand and identify with it and feel empathy for it. That is what's needed so that we could move to a level of awareness to the American public. Globally, socioeconomic status is one of the single biggest predictors of variations in health. Just to give you one example, this is work I did with colleagues some years ago using a large national data set, the panel study of income dynamics. And what is evident is that low-income Americans have an overall death rate that is 3 times that of high-income Americans. And at every higher level of income, you could in fact see the persistence of improved health linked to every higher level of income. So it's not just a threshold effect where those at the bottom are doing badly, but we see that pattern throughout the process. In the United States, socioeconomic status is strongly patterned by race and ethnicity. A striking pattern that helps us to make sense of even the coronavirus, the earlier onset of chronic disease. Here is data for the CDC showing that at every age, African Americans not only have higher rates of illness, but they get illnesses at younger ages. So for example, for high blood pressure, you can see age 50 to 64, over 61% of African Americans have high blood pressure at that risk, one of the risk factors for death linked to the coronavirus, compared to 41% of whites. Another challenge we need to think about, and that's the increasing rate of mental health problems in our society in general, but also what we are seeing occurring among our young people. Between 1993 and 2012, suicide rates among elementary school children more than doubled for African Americans. So it really raises questions. What does it mean for a Black child to be growing up in these United States that is leading to such striking mental health problems? The best of African Americans, those with a college degree or more education, have lower life expectancy than whites with a college degree, lower life expectancy than whites with some college, lower life expectancy than whites who have finished high school. This is national data for the United States. So it powerfully says there's something about economic status that drives health regardless of race, but there's something else about race that profoundly matters even after we've taken economic status into account. So we now have good evidence that interpersonal discrimination is one additional stressor that disadvantaged populations deal with that have negative effects on health. We want to talk with all of these challenges. What on earth can we do to make a difference? We need to build more health into the delivery of healthcare. So the first thing we need to do is to ensure greater access to care for all. What else do we need to do within the healthcare system? We need to eliminate inequities in the receipt of high quality medical care. We also need to provide care that addresses the social context. This is a recent report from the National Academy of Medicine of how we can integrate more social care into the delivery of healthcare. And it talks about the 5 A's, how our healthcare systems can raise awareness levels, adjust activities that alter clinical care to accommodate the needs of patients. We can have interventions that assist patients. We can align our activities and invest in assets within the community. And healthcare systems, as we saw in David's talk, can also play a role of advocacy. We can also build more health into the delivery of medical care by diversifying the workforce to meet the needs of all patients. This is national data for the United States, 2015 percent medical school graduates, and you can see 4.6 were Latino, 5.7 were African American, 0.1% were Native American. What else do we need to do? We need to create what I'm calling communities of opportunity to minimize, neutralize, and dismantle the systems of racism that create inequities in health. What does that mean? We need to invest in early childhood. What else we need to do is to reduce childhood poverty. Look at the rates of childhood poverty in America. Almost 1 in 3 Black and Native American kids, 1 in 4 Latino kids are growing up poor. As a proportion of all children, the largest group of poor children are Latino children. The second largest group are white children. The third largest group are Black children in terms of numerically the problem that we face. What else do we need to do? We need to keep the social safety net in place as a resilience resource. This is particularly an important point in the wake of the coronavirus and the economic impact it's having on communities of color. We need to improve neighborhood and housing conditions. We also have high quality evidence from a number of programs that if you just change the quality of the neighborhood environment, no intervention on health, you can dramatically, in fact, improve health. The last and maybe most challenging issue we face is we need to raise awareness levels of the problem of social inequities and build political will to address them. I would say there are 3 challenges, all of which have communication as a part of it. Most Americans don't know we have a problem, so we need to raise awareness levels that inequities exist. Secondly, we need to build political will to address them. And in order to build political will, we need to build empathy.